The next video features Dave Hager, Director of Pharmacy Clinical Services at UW Health, who describes the unique manner in which UW Health inpatient pharmacists are utilizing the Epic platform to send a discharge handoff summary from the inpatient pharmacist to the community or long-term care pharmacy where the patient will transition to once they leave the hospital. In a nutshell, at discharge, a standard report is communicated to the patient's community pharmacy. The report includes standard items listed on the screen. In the video, you will hear how the UW Health vision that began several years ago has grown, and how they partnered with 6 WPQC pharmacies this past year to evaluate the process.
So transitions of care has been a focus at UW Health for quite some time. We think it's important that when patients both enter and leave our organization, that it's done in the most safe and effective way. And we've had pharmacists really involved in the transitions of care process since the early 1970s. One of the things that we had identified as a potential gap is that really the first place that patients go when they leave our organization is to their community pharmacies. And that's another person who can help extend our care into the community and help assist our patients and help them keep them out of our hospitals and keep them at home. That one of the limitations that community pharmacists face is that they don't even know that their patients have left the hospital. They don't have easy ways of identifying where these prescriptions came from and how they're different. And a patient leaving the hospital probably has different needs.
I remember the days when a patient would walk in after being discharged, or many times it was a family member, to pick up a prescription. They didn't know what the patient had been on. We didn't know what the patient had been on. Invariably, the patient would ask, when do I take my next dose? And we had no idea if they had a dose before they left the hospital or if they needed one as soon as they got home. So in that respect, having that information at our fingertips has been great.
Just keeping everyone on the same page. We know before the patient is even in to pick up their new prescriptions from their stay inpatient if anything has changed or been discontinued, what decisions were made inpatient can kind of influence how we practice here in the outpatient setting, and just keeping everyone on the same page has been beneficial. I have one patient that's been in and out of the hospital several times, and his wife is the caregiver, and she just is amazed that we know everything that happened during his stay and can use that to benefit his care.
Well, I just think we're so much more well-informed, so I think you can have some conversations that you probably wouldn't have been able to before. And people come in from the hospital and you can ask them those questions like, what was it, is this a change or whatever, and a lot of them aren't in the right space to answer those questions. So if you have them, then you can just reinforce the changes, or you can talk about follow-ups, and so it's just another person as they're transitioning to give them support. So
I think the program really is designed to do something that I think we're very familiar with in healthcare, which is if I were a primary care physician or a hospitalist in my health system, as a pharmacist or as a physician, I would be asked to write a discharge summary and make sure that that primary care physician that's going to take over the care of my patient knows what happened to them on the inpatient side. And I think we as inpatient pharmacists, kind of broadly, should have similar expectations and responsibilities to making sure our partners, our primary care providers, our community pharmacists have that same level of data. What we've found is out of 103 patients that have been entered into this study, just out of these 6 partner pharmacies, they've identified almost 333 discrepancies because of sending that list. Now, many of those are intentional. I'm telling the patient and communicating to the community pharmacy that, yeah, we are starting this new medication because they had an MI. But what we also found is a large number of unintentional discrepancies which are really things that probably through the process of us obtaining the list when the patient comes into the hospital, the changes we made or sending them out, there were things that did not match between what we thought the patient should be taking and what a community pharmacy has on file. And those are really the ones that we want to resolve because those are the types of information that we're going to improve.